Good morning, everyone, and welcome to the virtual Knock Out Opioid Abuse Town Hall for the Newton Medical Center community. This event is hosted by the Partnership for Drug-Free New Jersey and Horizon Blue Cross Blue Shield of New Jersey. I thank you all for attending this virtual town hall and for your commitment to being part of the solution to this statewide opiate epidemic that also impacts Sussex County and the Newton Medical Center community. The Partnership for Drug-Free New Jersey and the Horizon Foundation for New Jersey are pleased to bring this discussion to this Newton Medical Center community today, along with our collaborative partners, the Center for Prevention and Counseling and Atlantic Health, as well as Sussex County. In 2019, the Partnership for Drug-Free New Jersey and Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, embarked on a new 2-year Knock Out Opioid Abuse initiative to address the opiate epidemic through community outreach, prescriber education, parent education, and education on safe prescriptions and disposal through our American Medicine Chest Challenge, a statewide awareness campaign, as well as continuing medical education for doctors, dentists, and nurses. In light of the COVID-19 pandemic, this initiative has expanded its offerings to include a webinar series and a virtual town hall, like today's event, so that we can continue this conversation about the opioid crisis as we all navigate through this difficult time. Please welcome, on behalf of Horizon Blue Cross Blue Shield of New Jersey, Ahmad Shiata, the group underwriter. Ahmad, good morning. Ahmad, are you with us? All right, I think we're having a technical issue. So now I'd like to take a moment and introduce and welcome Sussex County Municipal Alliance Coordinator, Nick Leozzi, to speak about the new overdose fatality review team that was launched in the county this year. Welcome, Nick.
Thank you, Tammy. Yes, in November of last year, the Sussex County Board of Chosen Freeholders passed a resolution creating the Overdose Fatality Review Program and the Overdose Fatality Review Team. The program it actually comes from 2014, where Maryland began reviewing data related to overdose deaths caused by opioids. The data they reviewed centered on the family, the medical, legal, educational histories of the people who had passed away from an overdose. It was modeled after child death review teams that take place in all 50 states. Its goal is to identify opportunities to improve services for people who are caught up in the opioid epidemic, to determine if there are any interventions that can reduce the risk of overdose and overdose deaths, improve the timing and response of interventions.
Thanks so much, Nick. We appreciate you being with us this morning. I'm now going to hand things off to today's moderator for our panel discussion. We have Tammy Horsfield, who's president of the Sussex County Chamber of Commerce. Tammy has worked with us on other Knock Out Opioid Abuse events, and so happy that you could moderate today's discussion. So, Tammy, I now turn it over to you.
Thank you, and good morning. I want to welcome all of you this morning to this Knock Out Opioid Abuse Forum. I'm Tammy Horsfield, as mentioned, president of the Sussex County Chamber of Commerce, and been very involved in the Center for Prevention and Counseling for many years. There is a support and involved in some of the programs in the past. We're going to start out this morning with some speakers, and each of them will have an opportunity to respond to a question. They'll have 5 minutes to speak. And if there are questions from any of our audience, they can certainly send us a chat that we'll look at the end of the program, and we'll do our best to answer as many questions as we can, of course, based on time as we move forward. So I'd like to start out first by introducing each of our panelists. Our first panelist will be Dr. Suvad Chaudhry, the Medical Director of Newton Hackettstown Emergency Departments. We also have with us our own Sussex County Prosecutor, Francis Koch. Good morning, Francis. We have Tina Owie, the Director of Prevention Services at the Center for Prevention and Counseling. We have Katie Kovarka, the Recovery Support Coordinator for the Center for Prevention and Counseling and a recovery coach with Sussex County CLEAR program, which is very well known in our community. And Robert Greiner, who is with Christ Episcopal Church. Welcome all of you. We're looking forward to hearing more from each of you on all of these very important topics. So without further ado, I want to make sure that we have plenty of time for some questions at the end. I'm going to move forward with each of our speakers. And I'm going to start out first with Dr. Suvad Chaudhry. And I have a question for you, Doctor. Can you discuss how the opioid epidemic reached this point and what impact you've seen the crisis have on Newton Medical Center and the surrounding communities? Good morning.
Good morning, Tammy. Thank you. I'm very excited to be a part of this town hall and take part in this initiative. So just to share an idea of the severity of the epidemic and how it's evolved, in 2018, the CDC reported there were over 69,000 deaths related to overdoses, and opiates accounted for nearly 70% of these deaths. When we talk about how things have evolved over the past 25 years, initially we saw a wave of prescription opiates in the 1990s, and the vast majority of the deaths were linked to both synthetic and natural opiates, including oxycodone, tramadol, among other prescription formulations. And as we started to learn more about the addictive potential of the opiates when they were first introduced by the pharmaceutical industry, we saw a rise in heroin as the preferred agent, and that became at the top of the list for overdose deaths, replacing prescription opiates. This was in 2010, the second decade of the 20th century. And in the third wave, starting in 2013 onward, we noticed a significant increase in deaths related to synthetic opiates, including those involving illicitly manufactured fentanyl. The market for illicit fentanyl continues to change, and it can be found in a combination with heroin, cocaine, and counterfeit pills. So at Newton and the surrounding communities, what we have seen is an increase in the use of synthetic opiates. And the challenge has been that these substances cannot be captured in our regular drug screens. So the true impact it's been having on our nearby communities and the youth has been underreported. This is why forums like this to educate and have an evidence-based approach to involving a multidisciplinary team is integral to build healthier communities.
Well, thank you very much. We appreciate your response to that question. And we're now going to move to our second question. I'm going to move to Prosecutor Francis Koch. And the question for you today is, could you outline from a law enforcement perspective the impact the opioid crisis has had on this community?
Thank you so much, Tammy. And I want to thank all the other esteemed speakers that are here today for this incredibly important webinar that we're having. You know, the Knock Out Opioid Abuse webinar is just one of the small steps that's been taken by this entire group to try to address this issue. You know, the effect on the community is multifaceted. As you all are aware, law enforcement, we have a duty to serve and protect our entire community. And that includes all those with a substance use disorder. I think really our community is affected in probably 3 or 4 primary areas. First, the individuals that have the substance use disorder, then their family, friends, then you bring in their employers, and then the rest of the community. You know, it's almost exponential. You start with one person who may have a substance use disorder, and how their tentacles reach out to the entire community, including law enforcement, is just, it's incredible and daunting. You know, with an individual with a substance use disorder, it may start with a prescription drug, and then they are no longer getting the prescription drug, so they start trying to either draw from savings if they have it. They start stealing from family and friends. They start stealing from their employers. they become less productive in their work. Family and friends are then directly affected because they're trying to help them find a way to a road to recovery. And then they eventually come through law enforcement, unfortunately, where they may be arrested or they may have an interaction with law enforcement because of the substance use disorder. If you take a look at the paper or on the internet with regards to most property crimes that occur in Sussex County, they all relate to, or not all, but a vast majority of them relate to someone with a substance use disorder, trying to feed that disease that they have. And that has an incredible effect on law enforcement, first of all, for enforcement purposes, investigative time, and also trying to change law enforcement's perspective on people with substance use disorders in a way to help and serve them, because that is part of their sworn duty. And those crimes relate from everything from shoplifting to theft to burglary to robbery, and then even driving under the influence of a substance that may cause an accident and injure. So now we see all the people that this affects. It affects, again, going out to the number of victims. So law enforcement has to address the victims' issues and has to address the issues with those with the substance use. One of the main things that's now happened with law enforcement, again, is that change in attitude. The change in attitude that we're not going to arrest our way out of this, which I think is a very ancient term at this point, but that we're there to help and that we're there to work. We've worked with the CLEAR program, with the Center for Prevention and Counseling, Operation Helping Hand, where we're going door to door just to help introduce recovery coaches to try to find a way to get a person to their path to recovery. As the doctor indicated, our numbers of overdose deaths, just in Sussex County, in 2013, there were 13 of them. That peaked by 2019 to about 40. This year, we are on pace to have about 41. I think the grave increase in the number, despite all the work we are doing, has to do with, as the doctor indicated, with fentanyl, which is an exceptionally cheap opioid that is easier for people to be able to sell. It's cheaper. And it's much more deadly. And unfortunately, that's having a negative effect not only on the individual with the substance use disorder, but with law enforcement officers as to the dangers that they go out. So as I said, this is multifaceted. It affects law enforcement in so many ways. And I appreciate everyone coming together, because it's only as this type of community and working together that we will be able to solve this problem, which I truly think we will. We will solve this epidemic. But again, it's as a community, and we will make Sussex County safer and a better place to raise a family. Thank you.
Thank you, Francis. So very true. And it's true that if any county can get through this, being the close-knit community that we are, we'll do it. So we can't do it without the support of all of our panelists who are here today, all of the professionals out there in the world here in Sussex County. But together we can make a difference. So thank you. Appreciate your words. All right, we're now going to move to Tina Owie with the Center for Prevention and Counseling. And the question for you this morning that I have is, in what ways have you seen this epidemic leave its mark on the community? And what are some of the unique challenges this area faces in addressing this issue? So good morning, Tina.
Good morning, everybody, and thanks for having me here today. So we live in a beautiful rural community, and we have more resources than ever before to combat the opioid epidemic, even during this COVID-19 pandemic. Yet, as you had heard from Dr. Chaudhry and Prosecutor Koch, we still have people dying. Since 2017, Sussex County has lost over 145 community members to drug overdose, a majority of them being an opioid overdose. So these numbers represent someone's mom, dad, daughter, neighbor, friend, and colleague. It's hard to find a person in our community that isn't affected by the crisis. If I had asked by show of hands how many people that were on this webinar today knew of somebody that's been affected by drug overdose, I'm sure the majority of us would have our hand up. So this alone has left a mark on our community. However, out of tragedy comes opportunity. and that's what we've been given, opportunities. The addiction epidemic has brought more attention to what people need to recover and what those resources look like. Prosecutor Koch had talked about our recovery coaches for a minute. Over the last 3 years, our recovery coaches, these are people with lived experience, have responded to over 1,500 people at Newton Medical Center. That means that 1,500 people were provided with an opportunity to navigate their path to recovery with guidance. That's amazing. The epidemic has also changed our community and has really changed the way we go about our business every day. It has created system changes within our county that include prevention strategies, better access to treatment, and more treatment options, including medication-assisted treatment. And systems are in place to provide 24-hour access to recovery services, and that's with the clear toll-free number that Katie is going to talk more about. So the tragedy of the opioid epidemic has led to our community leaders meeting our elected officials and our sector leaders in our community to becoming more resourceful and leveraging relationships and building partnerships to serve individuals and families struggling with addiction. And those relationships and those partnerships are only going to get stronger as we work together to combat this addiction. These system changes include law enforcement, physicians, hospital and emergency departments, treatment providers, pharmacists, and our school districts. Each system plays an intricate role, which was defined over the last several years in prevention, treatment, and recovery. So while there is hope in all of these system changes that have been put in place for prevention, treatment, and recovery, there are still challenges that we need to address. So funding for upstream prevention is a challenge. The funding we have now is critical and it's so important and it's saving lives, and we're so grateful for every penny of funding. But we need to prevent our community members from ending up downstream, and we need to prevent individuals from accessing the pathways that often lead to opioid addiction and prevent them from misusing in the first place. Also, there's an increased need for prevention education for families regarding addiction and youth use of substances. Youth are starting to use substances earlier and earlier. Alcohol and marijuana can be a stepping stone for youth to move on to other substances. So having conversations early and often with youth is critical. We need parents and guardians to understand if their child is using any substance. It's important to address. Early intervention provides the best opportunity for youth that are struggling and can prevent the progression to addiction. In addition, understanding the root cause of why youth and young adults are using is important. There may be an underlying mental health concern, trauma, or adverse childhood experience, which we call ACEs, that need to be addressed. When we're talking about ACEs, instead of asking ACEs or trauma, instead of asking what's wrong with a person, we need to start asking what happened to that person, because we know ACEs are linked to chronic health problems, mental illness, and substance use in adulthood. And finally, to conclude, we also need to be aware of our infants that have been diagnosed with neonatal abstinence syndrome, also known as NAS. Our latest data from 2017 indicates that Sussex County has one of the highest in the state with diagnosis of neonatal abstinence syndrome. The short terms of NAS are well documented. Long-term effects are still being studied. However, there is research that's been published that suggests that babies diagnosed with NAS could have learning challenges not only during their infant and toddler years, but through their childhood and beyond. So rather than say that these are all challenges, I will say we as a county have an opportunity to help create the infrastructure and support that's needed to help children and their families that have been impacted by addiction to help them reach their fullest potential. So thank you.
Thank you, Katie. Very interesting. The background and information on our community. So thank you. We appreciate you sharing those challenges, if you will, with us. So we're now going to move to Katie Cavazza, and we're going to have another question for you. How does the CLEAR program work, and what has it done for this community? And I have to say that I think some people really know a lot about this, but we can never say enough. So please share with us.
Thank you. And before I answer the question, I also, when you introduced me as someone that works for the center and as a coach with the CLEAR program, I also just want to introduce myself as a person in long-term recovery. And for me, that means that I haven't had a drink or use a drug since 2008. And I share that because I put myself out there to put a face and a voice to recovery. I am just one of over 23 million Americans living in long-term recovery. And, you know, we hear so much about the impact of addiction, but we need to know that recovery is also impactful. And that's really the whole point of the CLEAR program. So really what the CLEAR program, which stands for Community Law Enforcement Addiction Recovery, it offers Sussex County residents affected by addiction an avenue for help and support that just didn't exist before. So through the Center for Prevention and Counseling, CLEAR actually operates a 24/7 helpline that can be called or texted, and that connects callers to a recovery coach, someone that is in long-term recovery that has been trained, and they can provide information related to recovery. We assist people in understanding their options for treatment and recovery support, as well as for family members, and offer ongoing telephone support to help people navigate the system and any roadblocks that may come up, and to provide them the support in following through with the plans that they come up with. So CLEAR has really evolved since it began 4 years ago, and the collaboration of our partners is what really makes it unique and effective. The program has empowered community members that are living in long-term recovery from addiction, as well as their family members, to become trained as recovery coaches that provide the peer support for the program. And many of those volunteers are actually now employees of the Center for Prevention and Counseling. And CLEAR utilizes local law enforcement as a resource to refer individuals with substance use disorder to get the support. And it has allowed community members to actually seek help at police stations, making it really simple to access the help. Like the prosecutor mentioned, oftentimes criminal activity is a direct result of substance use disorder, and this program has provided our law enforcement agencies in Sussex County with a tool to keep our county safe by getting people help for their addiction problems. We also have representatives from some of our other partners in this presentation, namely Newton Medical Center and the County of Sussex. So in addition to providing easy access to free recovery coaching and system navigation for our residents, CLEAR has helped to reduce the stigma associated with addiction by really recognizing that recovery is a solution that benefits all of us, and shifting the approach from law enforcement from strictly punitive to being one that really offers help. And the foundation of this program and these partnerships has also positioned Sussex County to implement complementary programs more seamlessly. For example, Tina mentioned that recovery coaches respond to Newton Medical Center. That's through the Opioid Overdose Recovery Program, which is also a little more expanded. We actually respond to anyone with substance use disorder in the emergency department and throughout the hospital. Prosecutor Koch also mentioned Operation Helping Hand, which was started 2 years ago. And that uses law enforcement taking a more proactive approach to really reaching out to people that have had issues so that we can really get them help. So in addition to providing help and an avenue and a pathway to recovery, it's brought recovery into the conversation so that people know about the help that's available and feel more comfortable reaching out.
Well, thank you, Katie, and congratulations on your continued recovery. We appreciate you sharing your personal as well as professional experience. It means a lot to us. And it's just incredible, as a pioneer of the CLEAR program, Sussex County is a lot of the time on the cutting edge. So we appreciate all that's offered. And we thank Center for Prevention and Counseling for all that they do for our community, because it's just incredible. And that program, wow, gotta say, really makes a huge difference here. So we're now going to move to our final speaker of the morning in regard to the presentation, Father Greiner. And Father, I have a question for you as well. From your point of view as a leader of a faith community, what is the spiritual dimension of the current crisis here?
Thank you, and thank you so much for inviting me to be part of this panel. I know all of you, and it's been my pleasure to work with you in the past on this very important issue, one I have a lot of passion for and around. I'm a priest in the Episcopal Church charged with caring for a people, and the people extends beyond our members, but to those of the community as well. I love my job so much. I'm actually paid to be spiritual, and that's awesome. If you can get a job like that, take it. It's really good. But there are things that are difficult to walk with people. And I just wanted to talk a little bit about what I see, what I hear, and what I've experienced as a spiritual caregiver in this community. I've been a priest for 35 years, and I've been doing and seeing new things. I am burying children, teenagers from this county. I haven't done that before. To see the face of some child in a coffin is it's a chilling experience to sit with families that are devastated from this disaster, to share in their anguish and in their grief. There's something dark and ancient about it. I'm reminded of the bit from Jeremiah 2,600 years ago. He says, I hear a voice of Rachel weeping, refusing to be consoled because her children are no more. And so, I've been called into these kinds of family griefs, these mothers who understandably refuse to be consoled, and to sit with them and to practice this very ancient grief work of lamenting what's happened to them, and to be able to kind of develop that spiritual skill to sit with people as opposed to sort of fidgeting away from it, from the discomfort, which is a kind of an addiction in and of itself. I'm so happy that my friend Katie announced her recovery status. I have one as well, and we share the same year. I am a person in long-term recovery, and I was hopelessly addicted daily, hourly, physically dependent on alcohol. And I too have not had a drink since November of 2008, which is something that continues to surprise and delight me, not to mention the people of my parish as well. It's a great source of joy when I choose to divert my attention from whatever's making me concerned in the given moment to that very fact of that I made it, and I've come this far. It's really something quite amazing. I feel almost like a passenger from flight 1549, the Sully flight, who went through an experience that very so easily could have been fatal. And for me, it was not. It was not. And I have surrounded myself since 2008 with this band of kind of merry warriors, of fellow recovering people who have that same sense of giddiness about the gift that we've been given, the joy of this miracle. And Katie, thank you for saying that, because just as Prosecutor Koch pointed out, the devastation, of one affects many, but so does the recovery. I find that the hope that I experience sort of radiates out way beyond even the community of the recovering people, but to so-called normal people, are inspired by these kinds of stories as well. And so often it is an issue of kind of getting past the stigma of this, and that's why I'm quite vocal about my recovery status. I have degrees from Yale and Oxford, and I was a hopeless drunk, and now I am not. And it's a wonderful thing. So I just wanted to sort of conclude with a little kind of elucidating the spiritual dimension of addiction, because I think it's profound, both in terms of what ensnares a person into a substance use disorder and the way out as well, because I think at its heart, it is a spiritual kind of phenomenon or disease. If you understand spirituality to be that sense, that experience of being connected to something larger than yourself, of being connected to other people, to your true self, to nature, to your life, to being connected. And for folks with a genetic predisposition or with acquired or adverse childhood experiences, it kind of accelerates the likelihood that this kind of easy route into an experience of connection becomes more and more attractive. And that can so often happen, this artificial sort of easy pass approach to feeling okay, which is what we all want, just simply to feel okay. And but the tragedy of the substance use disorder is that it turns on a person and ends up taking away that very sensation, that very experience of being okay. And what gets amplified and accelerated and multiplied is I am not okay. All is not well in any sense. So you look at it in terms of the opioid crisis, some of the young, mostly men that I work with who have a history of opioid addiction, talk about their first use as being hugged by God, that's the experience of it. That's what it sort of feels like to them, this kind of spiritual experience. And for this kind of longing, that desire that's so heroic and noble and needs to be nurtured and recognized, the solution is evident, to sort of flip from that into a natural community-based sense of connecting, rather than this kind of easy way into that kind of experience. So it's in those kinds of connecting with others, connecting with some sort of spiritual practice. It's what I do with my 2 teenage sons. I want them to know how to, when they're anxious, when they're on the edge, when they're feeling overwhelmed, to have something to do to bring it down a few notches. And I see it sort of working in their lives. So far, so good, you know.
That's great.
And I see it happening in the lives of the people that I reach out to offer this gift to them. So thank you for letting me ruminate on this wonderful path. I see the pain, but I see nothing but hope as well. Thanks.
Well, thank you. And thank you also for sharing your personal life as well as your professional. It's amazing how addiction affects people of all statutes, from, across the board, all ages, all industries, and all community. So we thank you for sharing all of that. Before we go to our questions, because we have only, about 20 minutes left in the program, I want to quickly go and introduce to you Suvad Chaudhry from Horizon. He's a group underwriter, and I'd ask if he would come on and just say a few words as well.
Thanks so much, Tammy.
Are you there?
Yes, can you guys hear me?
Yes.
Yes, great. Thank you so much, Tammy, and good morning, everybody. First, I'd like to apologize for the tech issues I had earlier, but it is my honor to join you this morning, and I would like to thank all of you for your interest and attendance today. I know that this is a very challenging time for everyone, and we greatly appreciate your dedication to continuing the discussion on how we can knock out opioid abuse in New Jersey, especially during this critical time. As many of you are aware, due to the COVID-19 pandemic, the Partnership for a Drug-Free New Jersey has had to cancel all in-person town halls. The Horizon Foundation has been working with the partnership to develop ways to continue the conversation and community engagement through social media and through the partnership's website. Today's event is the first of our 4 virtual town halls being held over the next several weeks, which will focus on the opioid crisis at the community level. Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, is extremely proud of our collaboration with the Partnership for a Drug-Free New Jersey to have brought you today's webinar through the Knock Out Opioid Abuse initiative. This initiative is part of our company-wide response to address and help end this public health crisis across our state, and it represents a large portion of the Foundation's $1.8 million we have invested to provide support for our opioid prevention and education programs to help families and our members. In closing, I want to thank Tina, Katie, Dr. Chaudhry, Prosecutor Koch, and Reverend Griner for presenting today. I would also like to give a special thanks to the Atlantic Health System, Sussex County, and the Center for Prevention and Counseling for collaborating with us on this webinar, and to the Partnership for a Drug-Free New Jersey team for putting this important webinar together. Together, we
Oh, I think we lost you there. But we certainly want to thank you as well for your support in this program and participation today as well. I would like to ask if our freeholder is on. Is Sylvia Patillo there? She might want to share a message with us as well. You might need to unmute yourself. Huh? We may have to come back to Sylvia, but I am now going to ask a couple of questions that have come in, and I'll ask specifically to the speakers one-on-one. Dr. Chaudhry, have you seen a change in the way doctors prescribe opioids in recent years, and has there been a change in patients' attitudes towards opioids during the same time?
Yeah, that's a great question, Tammy. So we have seen, as there's been more education and initiatives with reducing the number of prescriptions given to the department, that's something that we focus and educate all the providers to really avoid the use of opiates, because even giving a single dose to somebody without a prior history of addiction, we know that can increase their risk of addiction down the line 3 to 4-fold. So at both Newton and Hackettstown, we've done a great job in using alternatives to address patients' pain, which is a very common symptom that brings patients to the emergency department, and using other modalities to treat their pain, and using opiates as a last resort. Nationally, what we see is about 18 to 19% of the patients that are discharged from the emergency department receive a prescription for opiates. We're about 6% at both Newton and Hackettstown, and that's been through education and our focus in reducing the number of prescriptions that are given upon discharge, and using alternatives that are becoming increasingly available.
Thank you. I am going to keep in mind that we do have only about 15 minutes left, but I want to make sure I get a lot of questions in, as many as we can. So, Father Griner, where do you find signs of hope in the midst of an overdose disaster? You're muted. Thank you.
Thanks so much. Yeah, good question. I see it in, primarily in the lives of recovered people. When you see people whose lives have been wrecked by substance use disorder, and then are able to sort of put together meaningful lives, to get married, to go on to great professions. And most touching and compelling to me is, Katie was making reference to it, to see people take their painful experience and use it for the benefit of others. And that's the real sign of hope, when it's not just so that I can have a fulfilling life, but that I can extend this gift to others. That really spurs me on. That and this, in your own description, Tammy, of this very caring, very tight-knit community, communities like Sussex County do better with this, where there is a kind of so many people that care about the citizens of this community and that are so willing to collaborate across professional lines like this. I mean, just look who's here today. You know, doctors, prosecutors, priests, and recovery specialists, and it's fantastic. And prevention, too.
It is. Thank you. Prosecutor Koch, very near and dear to our heart, the CLEAR program. Katie has spoken about the work done by CLEAR, which your office has been a key part of. How has the approach of law enforcement changed as the opioid epidemic has intensified in recent years?
Thank you, Tammy. You know, it's a dual type of approach. I think law enforcement for a very long time always believed that our duty was to charge people, put them away, and it would solve the problem. That was learned to be a mistake and a decision that would not work. Now, that being said, law enforcement is still there for that purpose. For those that are distributing these drugs, those that are causing the deaths of others, law enforcement is there for that purpose. People that are stealing and committing crimes against others. But law enforcement also sees the CLEAR program and Operation Helping Hand, for that matter, the incredible impact they can have and the ability to get someone on a road to recovery. We, in Operation Helping Hand, as Katie had indicated, it was like a door-to-door process where we came up with individuals that we believed either had prior times been Narcan, or they had other crimes that, you can see a pattern that this person may have a substance use disorder, and they're willing to go out, put those names together, and try to find that person a way to recovery. One specific case that happened was where a recovery coach and a law enforcement officer went to a residence where they thought a person was. That person was actually gone, but there was someone else who checked into that hotel the night before. It was a young woman who had gotten on the phone with her mother that night and indicated that tonight, I'm either coming to this room and I'm going to die, or someone is going to help me on my way to recovery. The next morning, Operation Helping Hand knocked on that door, and she accepted that. That has an incredible impact, not only on that individual, but the law enforcement officer that was there, and the fact that they can spread that word to the rest of the law enforcement community, how they saved a human life that day. Father Greiner indicated, as we talked about, the tentacles of a person with a substance use disorder and how long and reaching they are. It's exponentially more effective recovery. Recovery people have a far greater impact than those with the substance use disorder. Look at this panel. 40% of the panel are in long-term recovery. And not only in long-term recovery, they are addressing the needs of the community and being a positive impact. If that's not a reason for law enforcement to actually become an active member in this, and a participant and a cheerleader for recovery, I don't know what it is. Thank you.
Well, thank you, and thank you for all you do for our community. It's inspiring. All of our officials throughout the county. It's just incredible what you do. So I'm going to move to Katie. I'm going to try to get as many in as possible. In your own road to recovery, what was the most difficult, and what programs or methods made the biggest positive influence?
That's not necessarily a simple answer, but I'll go back to the concept of hope. And like Father Reiner mentioned, that feeling of hopelessness. My addiction started, my substance use and addiction was really when I was a young person. We know that when the younger people are, when they start using, the more likely they are to develop an addiction. And that progressed to the point where I was using intravenously as a 17-year-old. And that sense of hopelessness and that I was a failure was what prevented me from believing that I could change or even get help. You're not going to try to do something if you don't think it's possible. And I didn't think recovery was possible for me. So that was really the biggest challenge and barrier. And I needed a spiritual experience to really break through that so that I could believe my life could change. And really that was the most instrumental thing that happened in my life. It was a spiritual experience that led me to reaching out for help, to being open, for letting people into my life that could help me. Eventually, you know, my whole family found out about my situation, and I allowed them to, you know, talk with me and help me. And I had to change really everything about my life, and becoming willing to change things about my life is what really started it. So it's everyone's pathway to recovery is different. It's not usually just one thing that works for someone. It's a combination of things, but primarily believing that it's possible and just being open to accepting help and change is what helps me and what helps others.
Well, you're truly an inspiration, and the hope that you offer really shows other people the path. And so thank you for all you do and for making this really your whole life now. So thank you. All right, Tina, I've got a question for you. What programs are available in the community for prevention and support?
Sure. So we have several different programs that are actually grant funded through Division of Mental Health and Addiction Services. We have a Young Athletes Grant that addresses youth that might be more prone to using opioids, our young athletes. We know through diversion and through injury, they are more likely to be affected by opioid use disorder. So we have some programming for our young athletes. Also, our older adults, we have some grant funding that allows us to provide education and awareness to our older adult population due to the fact that, again, they're prescribed a multitude of prescription drugs and they are more at risk for misusing prescription drugs unintentionally, obviously. We also, through our two coalitions, the Coalition for Healthy and Safe Communities and the Vernon Coalition, we are always promoting Knock Out Opioid Abuse Day, our disposal boxes in our counties. It's a line item on both of our agendas every month to talk about prescription drug misuse. Again, that's one of our areas that we talk about for the coalition. I hope that answered your question.
Yes, thank you. I appreciate that. I do have a question that came in from a reporter with the New Jersey Herald, and this is for you, Prosecutor Koch. In many parts of the state, the overdose deaths have gone down. You mentioned hot batches of fentanyl as the cause for the increase in deaths. Can you elaborate? They also get, it's said here, if we don't run out of time, certainly we'll have some other questions coming on, but this question is an important one in regard to dealing with fentanyl. Can you elaborate and on that topic?
Yes, thank you. You know, with regard to the what we call a hot batch, what that really means is probably something being sold as heroin either has a small amount or a large amount of fentanyl mixed in, which has somewhere between 20 and 50 times more powerful than heroin. And the individual takes that drug and it becomes overpowering and causes them to overdose, and sometimes with death. You know, the question I think also related that why is Sussex County seem to be more affected by this with other numbers going down? There's a host of reasons. First of all, being in a rural community, it sometimes becomes more difficult because response times to an individual who may be in an overdose, it may be too late by the time you get there to administer Narcan. So that person may die as opposed to recover. And the fentanyl is coming, obviously, I think it's known, Sussex County does not have like a major plant, does not have major distributors from that. And it does come mostly from our urban cities and urban outlets. So those drugs are there in all the other communities as well. You know, so we are addressing that. And if you take a look back in January until the first week of February, we had 11 overdoses in that short period. the prior year, we never had a month that had more than 6, which even 6 is high. So that started off our year where we would have been over 100 people dying of an overdose death. We are, even with the COVID-19 happening, which unfortunately causes social isolationism and causes people not to have sometimes some of the outreach, or they feel more alone. You know, our numbers are at a pace to be the same as 2019. So our numbers, although came down, they're a tragedy each and every one. They have come down. But again, it was that one batch, and it affected such a large population in a short period of time. So I think it does affect the entire state. I think, you know, a lot of the things that are happening with Narcan is out, and we may not become aware of people that have overdoses because individuals may Narcan and save someone, which is a great thing that they're saved, but we need them to be able to either report to law enforcement or to the Center of Prevention and Counseling, the hospital, Father Griner, your spiritual leader, any one of these community members to try to get to your road to recovery.
Thank you, Prosecutor Koch. I appreciate that. We are now coming down to that hour, so I want to make sure that we have an opportunity to hear from our freeholder. So I want to check back and see if we have Sylvia or another representative on the call.
Hi, Tammy. Can you hear me?
Yes. Good morning, Sylvia.
Okay.
Great to hear you.
Good morning. I just want to tell everyone, the panel and everyone that's there, that I am so grateful for all of you. I mean, you all take part in this wonderful coalition that we have in Sussex County to bring so many wonderful resources and so many caring people. We have our prosecutor telling us that our police, and I know that he is as well, go door to door. I mean, I don't know what other communities do that, but Sussex County has such a wonderful group of caring people, our recovery coaches, that really make a difference. And I think we all know now that the COVID-19 shelter-in-place directive has caused problems, and we have the experts telling us now that we're seeing a rise in drug use and an increase in overdoses. But Sussex County will not lose the resolve to fight this battle and to win this war, and that's why I love all of you so very much. And that's why this type of a program is so important, because what our community heard today were all of our voices united with a very powerful message, reminding everyone in our community that we have the resources to help people that have substance abuse problems and health issues. But what we also want to offer them is hope. So today that message was hope is still alive in our community and recovery is still possible. And I'm just so proud to be a part of this and to have the opportunity to just thank you all once again for who you are. And so much of what you have given to this program is what makes it so wonderful. So thank you.
Thank you for that wonderful message and for the support that the county gives in regard to all of the programs that are out there to deal with addiction. We appreciate all of your efforts. So thanks again for joining us today. Before I close for the morning, first of all, I want to thank also all of our panelists for your expertise, for your sound advice, and for sharing information that's so important to this community. Again, I mentioned it earlier, but I can't say it enough. This is a really close-knit community. We can't do it without one another, but you know what? The nice thing is that we all know that we need one another. So thank you to all of you for that. And I'm now going to turn over to Angela Conover with the Partnership for a Drug-Free New Jersey to ask her if she would do some closing comments before we close for the morning. Good morning, Angela.
Good morning, Tammy. Thank you so much for your moderating. Appreciate that. It was a great conversation. And I thank all of you who are on today for joining the conversation. Thank you to our panelists for your expert advice, to Freeholder Bertillo, to Becky and Tina at the Center for Prevention and Counseling, Atlantic Health, and of course, Sussex County. And I hope that today's discussion has inspired you to make a difference in your community in this crucial fight against the opiate epidemic. And again, thanking Horizon for their hand-in-hand support as we continue to have these conversations across the state virtually. The Partnership for a Drug-Free New Jersey provides opportunities to continue to fight this epidemic. And this year, on October 6th, Governor Murphy has designated it Knock Out Opioid Abuse Day throughout the state to really increase the understanding of the opioid crisis, provide prevention and education information. And this mobilization will focus on educating prescribers as well as raising awareness among New Jersey citizens and families. This year's efforts will be completed completely virtual. There's information in the chat feature on how to get connected and some resources. You can visit knockoutday.drugfreenj.org. Once again, I want to thank all of you for being part of this conversation. Again, Tammy, thank you so much. There's an evaluation that's popping up right now on your screen. I would appreciate it if you could take some time to back, and we'll also be emailing you some additional resources and some additional evaluation tools. So once again, thank you so much for being part of the conversation to knock out opioid abuse in Sussex County and New Jersey. Have a good day,
thank
everyone.
you, Angela. Thank you, Angela. We really appreciate your support through all of this. And also the woman behind the curtain, Becky Carlson. A special thank you to Becky, always behind the scenes, but always out front, leading the pack, if you will. So we appreciate those efforts. And a big thank you to everyone who participated, all our guests who are out there, who are listening, who are taking in information for themselves or for friends or just for community. Thank you for being a part of this. If you have other questions or we didn't get to, we hope you'll reach out to the Center for Prevention, and certainly they will get back to you with the information. Again, thank you all. You've made a great impact in our community. We thank you for everything that you do here, and thank you to those who participated. Let's make this a great Sussex County. Let's kick this addiction, and thank you all for coming out today. Enjoy your day.
Thank you.